Having a clinician to discuss about the case in Greece and consideration opportunities, I will be much shorter for this, let's say. For the clinical part, it's, let's say, it's today a discussion that I hear all day long with very much interest. And we do have very different and contradicting approaches. And I think a lot of times depends on which kind of patients we see. I mean, I hear doctors who engage in smoking cessation, in which the patient or the smoker makes the first step to go to them, and he wants help to quit. This, for sure, they need to insist for him to quit. We get a lot of times having somebody with a myocardial infarction, he stops the first day. After 3 months, he starts forgetting the MI. He feels well. We are, let's say, slaves of our own success. You do a primary PCI, there is no damage in the heart. At 6 months, he doesn't even remember what happened in the hospital. And he comes and he says always the same thing. It's 2 or 3 cigarettes per day, doctor, which means in a couple of months it will be 1 packet. So yes, having alternatives in this case, or for somebody who fails, he's not stupid. He knows that he's harming himself. He's not suicidal. He can't stop it. Or the pleasure he gets is bigger than his fear, because both exist. It's always helpful to have more choices to give him. And if we confirm that there will be reduced harm products, for sure, it's very helpful clinically. Greece, we are very good at laws. And I think we are maybe one of the oldest countries in which made the law against smoking. Our first anti-smoking law was 1856, in which it was said it was the first ban of smoking in modern Greece in public buildings. I don't know what happened then, but for sure the 2010 smoking ban was the biggest disaster, because it was an excellent law in which you were not allowed to smoke in closed places, and by smoking I mean also vaping or heated products or all of them. And the problem is that although this law passed with various, let's say, professional categories complaining, we failed completely on that. I found this in TripAdvisor yesterday, which practically somebody is commenting about a restaurant, which is full of ashtrays, of course, and his comment was, I got food with free of charge smoking, because it was full of smoke. Which is the problem? It's a very good law. The problem in Greece is its implementation. We don't believe it, and the best way to make something not function is to give the responsibility to too many places. In Greece, you have responsible for applying this law local police, I mean municipal police, normal police, the health authorities from the Ministry of Health, and practically nobody cares. The Greek ombudsman tried, after having cases in which people were complaining about that, to find out what was happening. And practically, if you call municipal police, they say, we work until 4 or 5 o'clock in the afternoon, so what's happening in the evening is not to us. If you call the police, they answer that we have thieves and robberies and cases which are much more important, so we don't care if they smoke, let them smoke. We need to do something more serious. If you go to the health minister, they close at 2, and they are only in Athens. So if it's a no way out, if you don't decide that there is somebody with a full responsibility to avoid smoking in closed places, it will continue like that. So if we speak about opportunities in Greece, I think that's the biggest opportunity that we are losing. And as a cardiologist, we saw in all countries that were able to apply this smoke-free legislation, they had a significant reduction in acute coronary events, which was much bigger than the reduction in cigarette sales. What does that mean? That probably also passive smoking that was coming in closed places was responsible for part of this myocardial infarction. So we need to apply that, and that was, I believe, one of our first failings and one of our biggest opportunities, because each time you fail on something, that means there is an opportunity to save the next chronic place. Electronic cigarettes. If we have the requirements which were done the same way it's done in the EU. But if you read that, it's practically what Dr. Katsaounou said, which is like supplements. They just say, I have this inside, nobody checks, you don't have to check to see if this is real. You know that FDA, when they checked supplements, they found that in more than 100 of them, they had completely different substances than what were written on it, and they were banned. Nobody's looking if these cigarettes really act the way they prescribe, because they have a low window in which they can work the way they want, but we don't really check them. So that's a problem. It would be much more important to be able to control them and say that they produce this thing repeatedly in a good quality matter. That's something we are losing. And of course, again, you have a lot of small companies producing cigarettes. What's the problem on that? That you find incredible ads. You see this, the same safe and efficient, the new safe way of smoking, small companies having a publicity. What do we have to do with that? That's a public health matter, and somebody should directly ban them not to be sold in case they decide to do that kind of advertising. We have, let's say, that's the positive thing, is that we have a committee which is evaluating new tobacco products. So there is somebody who looks at what the files are inside. And we have a negative part that theoretically risk reduction is something important. And I believe that if we see that coming from the FDA, for sure it will be much more important for the medical community, because already having a marketing authorization is on the positive part for heat and not burn products. And if you get officially this claim, will be much more important. In Greece, we had the possibility from the Ministry of Health to decide if there will be any product that will have the possibility, after being checked by authorities, to say that it has a reduced risk of health, and that would be done by the Ministry of Health. And by the new law, the Ministry of Health does not have the possibility to judge on it. So it's strange when the Ministry of Health does not give to himself the possibility to have a judgment on what they should do, and if they will allow for somebody to have a comment of this. I don't say that Greece should decide, but if you see that all over the world a product becomes a reduced risk product, in that case, yes, you should also be able to do it after you examine it. We see that American College of Cardiology comments on e-cigarettes, and although there are all these doubts that we discuss these days, they are positive, and they try to say, yes, we don't know 100% what's going on, but it's much better than smoking, and try to turn into e-cigarettes practically for a smoker. And we see in various, let's say, meta-analyses that possibly we'll get exactly the same results for the heat and not burn tobacco products, but still we need time. I think US for this is one of the places, at least with extremely good statistics. Now that we will have also these heat non-burn products in the US, it's interesting to see what we will see in the post-marketing analysis. I will try, yes, I will not repeat all the rest. Closing, I would say that in Greece we follow for sure all the European regulations, and we try to comfort with them. It's important that we will stop being the last country in Europe in which we allow smoking in public closed places, and that should include all products. And for sure we must be more ready to be able to judge if products are reduced risk or not for the future. We don't have yet enough studies to be able to claim that a product is or is not reduced risk, but for sure we must be more open for these categories. Thank you very much. It was 10 minutes.